Hello, everyone. Welcome to another exciting session with Kopi Events. As usual, before we start our show, here is the Kopi with Vance Mark. All right, cheers to everyone. All right, so I'm sure everybody is at home right now, on a beautiful Wednesday evening, right now after dinner. Yes, so let's start up on our topic today. So today's our topic is all about cervical, and because the cervical awareness month that we are going through in the month of January, and I have a guest speaker, which is she have actually been on our show before, and such a lovely doctor who shares a lot of informations pertaining to women's health, and she's a gynecologist. She's also an advanced laparoscopist and a urogynecologist as well. So let's invite her and let's kick the ball started. Hello, Dr. Hung. Can you hear me, Dr. Hung?
Hi.
Hi.
Yes, I can. Thanks for
Thank you,
having me
Doctor.
on.
Thank you for having. We inviting you for the second time on our show on this topic of cervical awareness month. Maybe, Doctor, maybe we even before we even start. I mean, you don't need any introduction because you've been here before. How is this cervical awareness month started, and why is it only in January? Why not? I know there are so many months there to talk about. Maybe is there a particular thing why is January? Is it because of the importance that given to the starting of the year? Is it one of the reasons why?
No, it's not really. Well, unfortunately, there's only 12 months in a year, and there's
Yeah.
so many health problems that women can suffer from.
Yeah.
So January is cervical health awareness month, but generally every month we do have a focus on a certain women health issue.
Mm-hmm.
So there's no particular importance. It doesn't mean that December is the least important month, but generally
Mm-hmm.
it's great that you're doing more awareness about cervical health because that tends to be an area that a lot of women, ignore.
Mm. All right, Doctor. So I know we are going to go on a PowerPoint today, and the same time we're also going to talk a little bit on the a few slides and few questions. And I know some of our viewers also have already standing by with a few of their questions to ask yourself. Maybe perhaps before we even want to jump into the slides or even get into the topic as well. Doc, I mean, usually before every Kopi events, I will spend really a significant amount of time to understand what is the topic all about. And what I actually understand about this HPV and the pap smear test, and I went through a little bit more deeper, probably talk about the speculum, the scraper, the test, and so many things. It sounds as technical it is, but I just want to make sure that I get this right. So correct me, right? So there are two tests to be done. I mean, on a cervical, on the pap smear and the HPV. But could we say that HPV is also related to sexual activities? That's why it's been there because they say it's more about a virus. But is that can we conclude that as a findings or presentations?
Yeah, so you're definitely right. HPV is sexually transmitted, but it's very commonly seen among sexually active adults. So there shouldn't be any taboo about it whatsoever. But in terms of screening for HPV tests and the pap smear is actually done exactly the same way. So usually most women get it done with the gynecologist, but there are
Mhm.
also options that you can get it done very easily at your nearby GP or even at your nearest polyclinic. These tests are very, very readily available and advocated by the Ministry of Health of Singapore. So there's absolutely no excuse why we should be ignoring our cervical
Mhm.
health. But generally, how it's done is that, yes, it involves a speculum, and usually there's a tiny, tiny brush that we use to brush against the neck of the womb, which is the cervix, to actually get some cells that we then look under the microscope to see whether there's any changes in the cells or any presence of HPV DNA material. So that's generally what we do.
Mm. And doctor, and also, is it because of the I mean the cells, right? I mean, it's a bit strange why these cells are keep on changing, and especially pertaining to women's health. Women tend to, I'm not sure if I'm saying it this right, but I think I have seen many cases, probably you will agree or disagree, that women tend to suffer a lot of health issues comparison to men. I mean, is it because of the rebirth, the production system, the ovaries? Is it because of all these things that women have to make sure that yearly they have to keep on doing all these tests to make sure that they stay not only fit but also be healthy as well? Is that one of the reasons?
Unfortunately, in exchange for our ability to get pregnant and nurture a child for 9 months in our womb and basically our childbearing abilities, women have exchanged that with a whole host of health problems that men actually don't need to suffer from. So that's actually, I guess, a pro and a con when you think about it. But I'm sure at the end of the day, a lot of women will never trade this ability for anything else under the earth. So it's probably a balance that we women have to take in terms of taking care of our own women health and also sharing in this joy of motherhood.
Mm, okay. Okay, Doc. So I think we will go into the slides as what you have prepared, and then perhaps then later we will go into more details and explore a little bit more.
Sure.
All right. So yeah. So viewers who are watching this, please do share and like as well, so that more people can actually come on board and view Dr. Ng's presentation. We are talking about the Cervical Awareness Month, that is January. So please do share and like. Thank you. So in the meantime, if you do have any questions, you can also post it in the comment section where we are going to take it on shortly after the presentation. So yeah, it is.
So can you see my slides?
Yes, we do.
Yeah. Okay. So, in honor of January, obviously for Cervical Health Awareness Month, there are just a couple of slides that I've prepared that I feel that are must knows for every woman out there. And so, before we start, we'll just go through the whole anatomy of a woman. So, I have here a diagram that shows the woman reproductive organs. So, at the central of it all is the womb, otherwise medically known as the uterus. And then from the uterus itself extends two fallopian tubes, and that's where the meeting place of the sperm and egg usually takes place. And then the end of the fallopian tube will be your left and right ovaries. Now, at the bottom of the womb or the uterus is actually called the neck of the womb or the cervix, and that's really where the opening to the womb is. Beyond that is then the hollow tube known as the vagina, and beyond that will be the vulva, which is the external genitalia. So the focus on our talk today would be the neck of the womb, otherwise known as the cervix. And you can see here on the chart on the right that I've put up is actually from the Singapore Cancer Registry. And it actually talks about the top 10 cancers affecting women in Singapore from 2014 all the way to 2018. So you can see here the usual suspects. The first one, breast cancer. But you do see here that cervical cancer actually features at number 10, which over 1,000 new cases of cervical cancer being diagnosed in women in Singapore per year. So it's definitely something that we need to look into and raise awareness about as well. So a lot of people ask me, what is the risk factor of developing cervical cancer? And the answer is really rooted in human papillomavirus infection, or otherwise known as HPV. It's
Yeah.
not just a HPV infection, but the key is that it needs to be of the high risk type and it needs to be persistent. Only when you get a persistent high risk HPV infection, then you are at a higher risk of developing cervical cancer. Now, it's very, very important to know that in the early stages of cervical cancer, some or most women can have absolutely no symptoms at all. But as the stage of cervical cancer progresses, some women can start developing certain symptoms. And these symptoms will include things like bleeding in between your periods. So, for example, if you are having regular periods once a month and suddenly you are experiencing bleeding in between your periods when you are not supposed to, like unscheduled bleeding, or if you're experiencing bleeding after sex and this is something new that you have not experienced before, or you have already attained menopause. So menopause usually refers to 12 whole months or 1 year of not having any periods, and then suddenly you're having bleeding all over again. Or some women may experience some very foul smelling or increased amounts of vaginal discharge. And then there are some women who may report having discomfort during sex. If you are having one or more of these symptoms, then it's highly, highly recommended that you get yourself checked out by your gynecologist, especially if you have been neglecting your cervical health and not have had any cervical screening in the recent past. Now, one take-home message at the end of today is that if it's detected in the early stages, cervical cancer is very easily treatable. So you should try and look out for the symptoms as early as possible and seek medical attention. Now, this flow chart is something that I go through with all my patients who come to me for cervical health screening. And I'll go through it in detail so that you understand what's going on. So on the left-hand side is normal, and on the right-hand side is cervical cancer. What women need to know is that from normal to cervical cancer is a very, very slow process. It takes many, many years before one starts developing cervical cancer. And before cancer, there's usually always a stage called precancerous changes that starts occurring in the cells. Although these cell changes can be then classified into mild, moderate, and severe, that's what the pap smear is supposed to pick up. It's designed to pick up precancerous changes in your cells, and that's the reason why you should be doing it at least once every 3 years. But of course, from research, we have now realized that HPV infection, is the one that is causing the precancerous cell changes in the cervix. And so from there, we have designed an HPV test, whereby if you take this test and you test negative for any HPV presence, then your risk of having cervical cancer in the next 5 years is extremely low. Therefore, you can then afford to test yourself at a longer interval, once at least every 5 years or so. But if you take this HPV test and it comes back positive, it doesn't mean that you need to panic, because most of the time it doesn't mean that you have cervical cancer. It really depends on what type of HPV you tested positive for. Sometimes it's as simple as taking the same sample and running a pap smear and making sure that HPV infection hasn't caused any precancerous cell changes. But of course, if it comes back really positive for a super high risk type, then you may need to go for something called a colposcopy. A colposcopy is pretty similar to how a pap smear is done, except we make use of a special machine called a colposcope, and that has a few magnifying glasses that we look into more detail of your cervix, where we apply different medications on the cervix and look for any color changes that might light up the precancerous cells. And then from there, we may need to take some biopsies here and there. Now, very, very much like COVID, HPV being a virus, there are many, many different strains. So there are over 100 different types of strains of HPV, and we group them into two groups. One is the high risk, which is the cancer-causing type, and the other one is the low risk, which is a non-cancer causing type. And so among the high-risk group, aka the cancer-causing group, we do know that the 16 and the 18 cause majority of cervical cancers, up to 70% of them. And among the low risk, which is a non-cancer causing HPV types, about 6 and 11 cause overwhelming majority of genital warts, which is troublesome but doesn't really translate to cancer. Now, this we have put from a health hub of Singapore, which is very, very readily available. And I encourage all women listening in here to visit this website to get very good and very concise information about your cervical health. So it talks about what women should be looking out for in different stages of their life. So when you are about 9 to 26 years old, then you should be looking into reducing your risk of cervical cancer with the HPV vaccination. And I'll be going through some details about the HPV vaccination in the subsequent slides. When you move on to the next phase of your life and you're between 25 to 29 years old and you've had sex before, then the top most recommended test is actually the pap smear test. And what the pap smear test does, like what we discussed in our previous slide, is it actually looks for abnormal changes in the cervical cells. Now, some people might ask me, why are we not doing a HPV test in this age group? And the reason is because in this age group, we do know that the immune system is very, very strong. So most HPV infections are usually cleared by your own body. So doing HPV tests in this age group may lead to some unnecessary stress and unnecessary follow-up tests as well. So the ministry's recommendation at this age group is still the good old PEP test. But when you reach an age of 30 and above and you have had sex before, the recommendations for the first line test is actually the HPV test. So as mentioned previously, the HPV test is done exactly the same way as the pap smear. And the only difference is that the HPV test will then check whether or not the cells from the cervix or the neck of the womb actually has the HPV DNA. And they actually zoom in to see whether is any high risk HPV strains that are present in your body. So this is what you should be looking out for when you are 30 years and above. Now, a little note on the HPV vaccination. There are mainly three types of HPV vaccination that's available in Singapore. The one that came out earliest on the Singapore market is called the Cervarix. And then subsequent to that, something called Gardasil 4 came out. And the latest version of the HPV vaccination is actually called Gardasil 9. Now, they all cover some form of HPV. The earliest type, which was the cervix, covered 16 and 18. So if you remember, 16 and 18 actually cause 70% of all cervical cancers, while the other high-risk subgroups like 31, 33, 45, 52, and 58 added together with 16 and 18 causes about 90% of cervical cancers. So the coverage for Gardasil 9 is obviously higher than the older HPV vaccines of Cervarix. They also cover in the Gardasil the HPV 6 and 11, which, if you remember in the previous slide, causes about 90% of all genital warts. So in terms of getting a Gardasil vaccination, you will be affording yourself some degree or good degree of cervical cancer protection, as well as a very good level of protection against genital warts. Now, in terms of MediSave coverage, if you're between the age of 9 to 26, there is MediSave cover that you can claim for if you go for the Cervarix or the Gardasil 4 vaccinations. But unfortunately, because the Gardasil 9 is still a relatively new vaccine in the market, it is not MediSave claimable. Now, these are the top two questions that my patients typically ask me in the clinic. And it's a very, very common misconception that we hope to clear up in this session today. So there'll be a lot of women who say, actually, I only had sex once in my lifetime, or, it's been more than a decade or like 20 years since I last had sex. Why do I still need cervical cancer screening? The answer is yes, you still need to do regular cervical cancer screening. And remember, the reason is because the time from normal to development of cervical cancer is very, very slow and very, very long. So as long as you have had sex before, we do recommend that you have regular cervical cancer screening so that if there's any problem, we can pick it up really early and treat it well as well. The second topmost question that I do get from patients, and this is from the cohort of women who have had gone through a series of HPV vaccinations. So they come to me and they said, actually, I've already done the vaccination. Do I still need cervical cancer screening? Isn't it supposed to protect me against cervical cancer? Now, it's very similar to the COVID vaccine. So you can have the COVID vaccination, but still get COVID infection. So the cervical cancer vaccination is exactly the same. You have to remember that protection is not 100%. So in the event that you don't lie within the coverage or you are infected with a different subtype, you will still recommended that you have regular cervical cancer screening. It doesn't mean that you have a HPV vaccination, you have a batch against like all protection of HPV or all protection against cervical cancer. Is not the case. So we do recommend that women, in fact, we emphasize that even if you have completed the HPV vaccine, you still need regular cervical cancer screening. So
Thank
that's
you.
it for my slideshows.
Doc, so that was very good because that actually given a little indications what they should do. But of course, we have more questions that's going to come up. But is the HPV vaccination, right? We talked about it. Is it a compulsory for all women? Because we do have another set of question that if a woman says, hey, you know what, I'm a virgin, all right, do I need to have this vaccination? No, whether I have to get the test done, cervical test, cancer test done. So, what is your expertise, doc, on that particular
Yeah.
question itself?
So currently, the HPV vaccination is not compulsory in Singapore, although we as gynecologists are really pushing for ministry to make it compulsory, because how often can you say that there's a vaccine against cancer? You know, if we can have vaccines against breast cancer, colorectal cancer, to be honest, I think a lot of us will sign up for it immediately.
Yeah.
So the fact that modern technology has managed to come up for quite effective vaccination, in fact, it was just published not long ago in a very high impact journal that the HPV vaccination actually reduced the incidence of cervical cancer by 90%, which is a staggering amount. So if only we can make it compulsory and MediSafe claimable for all women in the appropriate age group to get this HPV vaccination, I think in 10, 20 years down the road, when we look at the top 10 cancers affecting women in
Yeah.
Singapore, you will soon see that the cervical cancer is not even in that list. And that is really a dream of a lot of gynecologists out there, you know, to actually reach that stage of very high cervical health awareness among women. So
Mhm.
that's what we aspire towards, and that's why we are actually here this evening.
Yeah, doctor, is it could be the reason because of the fear of the unknown of the vaccination, perhaps, right? The HPV, or even if they fear of having this pap smear, because if I mean, because the procedure sounds a little, I mean, of course, probably some people, what you're putting a speculum, and then you're going to do scrap out, and then you're going to do a test, and then within 3 weeks, I'm going to get an answer. So probably the unknown fear is one factor. Another factor is, will I have pain? Um, Probably best would be you, doctor. I mean, if you can tell our viewers, what is the pain threshold one should not be fear of?
I think the fear of the unknown can stop us from doing and achieving a lot of things. That's very important. But you need to understand why you're doing the test in the first place. So a lot of women, when they actually understand the importance of this test and they actually talk through the whole procedure of the gynecologist, they actually learn to be able to relax during the pap smear. And to be honest, if you are relaxed, generally the pap smear can be done in less than a minute. It's not something that you need to struggle for, like, 10 minutes on the couch or something like that. As long as you are relaxed, you know what you're in for. you know mo- Most women can get it done in seriously like 30 seconds or less than 1 minute, so there's nothing very much to be afraid of. But one important note is that if you are virgin, which means that you never had sex before, there's actually no need to do the HPV or pap smear at this point of time, because we don't want to be doing anything funny to the hymen. But once you have had an experience with sex, you have sexual intercourse before, then it's definitely recommended that you start thinking about doing pap smears and HPV tests. And that is the same principle why we recommend the HPV vaccination to be done in women from 9 to 26 years old, because we assume from the research that in this age group, you will find the highest proportion of women who haven't had their sex debut before. So if you have not had sex before, then it's a very high likelihood that you haven't been exposed to the HPV virus before. And therefore, getting the vaccination at this point of your life stage would be the most efficacious. So that's what we are basically aiming for.
Doctor, in Singapore itself, when we talk about all the other part of the cancers, right? Of course, like lung, the brain, and so many cancers are there. Is it could be the lack of exposures or the awareness or the education on the cervical, especially, or even the stats. Of course, stats is just a number of metrics, but what is the stats in Singapore? I mean, do we have any kind of stats that we compare a woman, let's say 1 to 10 or 1 in 100? What is the possibilities a woman may have a cancer, the cervical?
Actually, the possibility is not high and is actually going down. And we have seen a positive trend in the past 10 years since the HPV vaccination was introduced in Singapore. So we hope that this trend will continue. But in terms of, the incidence of cervical cancer, it's actually about only 10% of new cases if you think about breast cancer. So, although breast cancer is very highly publicized, it's almost a ritual that a lot of women know that they need to go for mammogram screening, but it's somehow not as intuitive that they want to go for cervical screening. In fact, most of the women that I see who start off their cervical screening is only opportunistic. So only after they've delivered their child, and then we start talking about the other health issues that you need to take note of. That's only
Yeah.
the first time that they realize, oh, I need to do cervical screening. I never thought about that before, because a lot of women, their first contact with a gynecologist is usually only when they fall pregnant and when they are due for childbirth. And so we as gynecologists usually try and take the opportunity to try and educate our patients as far as possible. Even we catch them just after the delivery and say, look, these are things that are very, very important, because unfortunately it's not at the point in our society is as ingrained as doing a mammogram screening in terms of the pap smear and the HPV test.
And also, if we catch it earlier, I mean, doing the testing, the pap smear test to find out whether you got HPV or the cancer, the treatments will be faster, and can the cancer be chased away?
Yes, so definitely if you detect pre-cancer changes or even the early stages of cervical cancer, it's super treatable. In fact, for all of the pre-cancer changes, if you're able to detect it in that stage, treatment is as simple as a day surgery procedure. It doesn't involve you even going through a major operation or staying in the hospital for days on end. So the most important crux is that you should catch it at the pre-cancer stage so that you can get treatment over and done with quickly. But even if you only manage to catch it in the cervical cancer stage, as long as it's in the early stage, it's very easily treatable with just simple operation and a very, very high success rate, a cure rate as well.
Also, dog, is it could be also be the reason of stress? Can stress affect your civic?
Well, there hasn't been a very definite link to link stress and your cervical health, although there have been some studies to show that women with cervical cancer and a stress related disorder, they are somehow more likely to die from the disease. And also, there have been some studies to show that if you are a pregnant mom and you are under a lot of stress, then there's usually also a slightly higher increased risk of you going into preterm labor. So there's no definite link between stress and the cervix, but definitely stress has been implicated in a lot of diseases, and the cervix is, one of them.
And Doc, how about the food? I mean, we always want to talk about the food. Is there any particular food that is good for the cervical? A particular thing that for your? I mean, I'm not sure, because that one of the questions that always pops up whenever we talk about a health topic.
Well, in terms of food for the cervix, there aren't any specific, but we do know that incorporating a diet that is high in antioxidants is actually very helpful for your cervical health. So antioxidants would include things like vitamin A, C, D, and E, and there's also a compound called lycopene, which is readily available in things like tomatoes, watermelons, and stuff, and those have actually been shown to reduce your risk in developing pre-cancer of the cervix or even cervical cancer. But generally, I think it's a good idea to incorporate antioxidants in your diet in general, not just for your cervical health, but overall health as well, because it's been shown to reduce free radical damage.
Free
So it's
radicals,
something
yeah.
that you should certainly think about.
And I think they also should consider, I mean, everyone should have a dietitian or nutritionist to actually to understand, what we are putting in. I mean, most of the time, we are binging on something that we are eating out of hunger. So I think that also could be one of the factors as well, like stress. Stress eating as well is also an issue right now. I think most of us are doing that. So yes, definitely, doctor. And how about I also have got a question, doc. I mean, frequent that we want to get this cervical checked on a yearly basis. I mean, of course, it's been a challenge to get a woman to understand that this is important to come in. But if one has done it in the first year in 2022, when will be the next test should be?
So it really depends on your age and what test that you did. Unfortunately, in this COVID pandemic, I've seen many patients shelve their cervical health right at the bottom of their priority list. So I've actually seen patients come in who said, "Oh, the last cervical health screening that I did was pre-COVID." And then you think about it, oh, that was already about 3 years ago because COVID doesn't seem to be going away anytime soon.
Yeah.
But it's very important to realize that, even amidst this COVID pandemic, there are other health issues that will still go on and still require your attention. So if you are between 25 and 29 and you're having a pap smear done, then it's recommended that you do once at least 3 years. However, if you're 30 and above and you're opting to do a HPV test, then you can afford to do it at a longer interval, like once in every 5 years. But that's the intervals that we're recommending is dependent on the test result. So if the test result comes back negative, then obviously you can do it once in 3 if it's a pap smear, or 5 if it's an HPV test. But if your test result comes back, abnormal, then you will need to discuss with your gynecologist to see, A, do you need further investigations, or B, do you need some form of treatment, and what is the appropriate follow-up interval? Because for abnormal results, even though it means that you don't have cervical cancer yet, but the importance is regular monitoring so that you can catch it in the event it turns to pre-cancer or early cancer, so that you can catch it fast.
Doctor, what will happen in the last stages? I mean, if someone have not done the test, and then if there will be any presentation if they already have it as cervical cancer, and then will there any kind of presentations that they need to know? Probably I got this out of five, I got these three, so I better go and see my gynecology, because most of the time, whether there's a sign or symptoms or pain, people tend to ignore. If they got a pain, they will say, oh, it's okay, fine, I'll put some ointment. Or if I got a headache, but if the pain persists for more than 1 or 2 days, probably the recommendation, then I think they should go and check with the professionals, with doctors, not just taking it and just taking it easy. But for cervical cancer, if someone has already had it, right, and the person doesn't know it, will there be any presentations like pain, bleeding, or maybe they're losing weight, or will there be any kind of negative presentations that we are looking at?
So the big problem with cervical cancer is that majority of women don't have any symptoms until it's too late. And that's the reason why we try to advocate screening and catching things early. Because by the time you get to the stage that you're starting to have symptoms, typically when we investigate, then we already find that the cervical cancer is quite advanced in terms of stage. But some symptoms to look out for would be definitely bleeding when you don't expect to be bleeding. So even if you're having, little bleeding episodes in between your periods, and you know that your period is not due to come, anytime soon, or you're having bleeding after sex, then it's time to probably get yourself checked out by a gynecologist. In fact, some women may not have abnormal bleeding at all. They just actually have only, they seem to have more discharge than usual. And then the discharge seems to smell a little bit off. And those kind of circumstances, you should also get yourself checked out by a gynecologist. Because by the time you get into symptoms of pain or loss of appetite, loss of weight, then those are really, really quite advanced already. So you don't really want to get to the stage.
Okay, doc, I got a question from a viewer here right now, mentioning about the IUD. All right, can IUD increase the risk of cervical cancer?
So technically not, because the IUD is, or otherwise for the rest of our audience, the IUD is actually a short form for intrauterine contraceptive device. So the IUD is something that's fitted inside the womb to actually do some functions. So one is for birth control. That's the most common reason why we use it. And sometimes the IUCD that is implanted with hormones, otherwise known as the Mirena, can also work to help women with period problems like super heavy periods or very painful periods. And so the IUD being situated in the womb itself doesn't really have too much effect on the neck of the womb, which is the cervix. So it hasn't been shown to put you at a higher risk of cervical cancer. But with a IUD inside or without a IUD, you should still stick to the same intervals of cervical cancer screening that we recommended earlier. So the presence of IUCD doesn't really make a difference on as to how often you should be screening for cervical cancer.
Thank you, doctor. Thank you for that. I hope that has answered that particular viewer. I have another one. Of course, that's through the message itself. I think pretty shy. Not to mention him here. Okay, I won't mention. I've actually, I mean, not high, but she. So seems like a high. Okay. I've installed IUD a couple of years back, and I was conceived. My gynecologist was shocked, and I was double shocked together with my hubby. Until now, we have our third child, and we can't find the IUD where it went. So I mean, I'm sorry. Congratulations on your second kid or third kid, but but so yeah. So I think our concern is where is the IUD, and both of them are shocked. Does this happen, doc?
Yes, it does happen, but I think okay, overwhelming majority of the time, if you can't find the IUCD, most likely it's dropped out. And because the IUCD is such a very, very small device, so actually the actual IUCD itself is only about 2.5 centimeter, is super small actually. So most of the time, if it gets flushed out, I would say that it probably happened when you were having your periods in the toilet or something like that. And before you knew it, it dropped out and got flushed out of the toilet. But of course, there's still a very small chance that the IUCD might have migrated the other way. That means, through the womb into the tummy or something like that. Usually that is very rare. So your gynecologist will have probably checked that out. Sometimes maybe do an x-ray or even a blood test to see whether the IUC is still kicking around. Very unlikely. So given that you have conceived 3 times after the IUCD has gone missing, if you want to close shop after this, you might want to consider another form of birth control that maybe works a
Okay.
bit better for you. But generally, I would say the IUC is actually supposed to be very, very effective in preventing pregnancy as long as it stays in the right place and it doesn't drop out.
So there's still a small percentage that it can get lost or it get flushed out, right? All right. Oh, that also explains to that particular viewer as well. I have one more, doc. It said, do all HPV strains cause cancer?
No. So there are many, many different strains of HPV, and there are two main groups. So there's the cancer causing group and the non-cancer causing group. So non-cancer causing groups are the ones that are just a bit troublesome, but they don't actually eventually lead to cancer. And so we do see them quite commonly in the form of genital warts or even anal or vulvar warts. We see them around the vagina. And those are typically caused by the non-cancer causing HPV. The cancer causing HPV are what we call the high risk kinds. And as we talked about earlier, the two main numbers that we usually look at are type 16 and type 18, because we do know now that they cause, about 70% of all cervical cancer. So it doesn't mean that you have a HPV that you need to freak out because it's definitely going to cause you cancer. It's very, very important to understand which type of HPV you got infected with. In fact, even if you got infected with one type of HPV, research has shown that it's quite rare for one woman to be infected with multiple HPV types at the same time. So it doesn't mean that you are infected with one type of HPV means you really got all the other 100 types of HPV. It's really not the case. So it's very important to understand, number one, which type that you got infected with, and whether or not it has any cancer causing consequences. And that's probably something that you need to talk about in when you discuss with your gynecologist.
Doc, we have. I think our talk has made sense to some women out there because she just messaged saying that in our message as well. Thank you for these vents and Dr. Ng. I make an appointment for cervical cancer screening. Thank you. You can actually look for Dr. Ng from ACRM. Where are you located at, Doctor?
I'm currently at Glen Eagles Hospital.
Okay. You can also Google Dr. Ng Kailin to get more information about her, and you can actually make an appointment with her as well. So, Doc, I mean, I mean, in the previous session, I think a couple of weeks ago with Dr. Sriram, the vascular surgeon, also came on board. We talked about a lot about women's issues. But, it seems like, there's a couple of tests that a woman have to do on a yearly basis, but there seems to be a lot of screening. I need to do my mammogram. I need to do my pap smear. I need to make sure that my ovaries is good, my uterus are fine. I don't have fibroids, and so many things. It seems like when a woman is born, you probably might have a checklist and say these are the checklists that you need to do. Well, perhaps the man, I know. I mean, I'm not comparing here, but it seems like there's a couple of issues that a woman should take note of their health. Probably should we just touch that a little bit on doc, so that a woman out there
Yeah,
will also
sure.
understand.
So, if we were to run through the different life stages of a woman, when you are like a teenager, like, when you hit pre-puberty at about 9 years old to 26 years old, you don't actually have to do much in terms of screening, but more in terms of preventative work, like the HPV vaccine, like what we talked about. Then when you reach the age of 25 years old to just before 30 years old, then it's time to consider your pap smear screening if you ever had sex before. Once you hit 30 years old, then it's probably time to switch to a HPV test because that's been shown to be more effective in the older age group. And then once you hit 40 years old, it's time to start doing your mammogram screening. So as we said earlier on, the pap smear, if it's negative, you should do it every 3 years at least. And the HPV test once every 5 years at least. Now, when you hit 40 years old, the mammogram should be done once a year. So from 40 to 50, that's yearly mammograms that you should be looking at. And then once you hit the age of 50 years old, then you should still continue with a mammogram screening, but the Ministry of Health says that you can take a small break and do it once every 2 years. Now, from the start to the end of this, any time when you experience any issues, let's say in terms of your menstrual cycles, your period problems, or you start encountering issues with, trying to get pregnant or your fertility issues or something like that, then it will be time to check in with a gynecologist. And that's when you start getting your baseline ultrasound pelvis. And on the ultrasound pelvis, we would then look for the common gynae conditions that can affect women. So things like fibroids that can grow in the womb or cysts that can happen in the ovaries and stuff like that. So it is not easy to be a woman, but ultimately, if you can keep track of your own health, then you should be able to catch most problems very early, because most of the problems actually when caught early are very treatable.
Yeah, thank you for that, doc, because it definitely eye opener for a lot of women out there also, because these videos were recorded as usual and it's in our social media, so anytime they can actually pop into that and view it. Doc, also talking about that, it's like you bring up a very excellent point. All these tests are very necessary, but we are just talking about the woman, the ovary system, the uterus, and the womb, and so on and so forth. But we also need to make sure that we do our HbA1c test. We want to do our blood test. We want to do our cholesterol test. We want to make sure that our weight are fine with the BMI, and so many medical tests that we need to do to take care of this piece of equipment, machine, body. So I think it's a wow high maintenance rather than having a car. Car you just send for 1 year, once a year or maybe twice a year, and get it all done. But for the human body, I think you have to do so many tests to make sure that you take care of that, right?
Correct. So what I highlighted just now is more specific to women, but unfortunately, we still need to take care of the other general health as well. So I usually tell my patients once they hit the age of 40, then they need to look into other aspects of their general health as well. And that's when your cholesterol screening starts coming in. Your screening for high blood pressure, pre-diabetes. In fact, diabetes is extremely common in Singapore. About 1 in 10 adults will have it. So it doesn't discriminate between men and women, unfortunately. So
Yeah.
you do have to get all these things screened. And then later on in life, when you are menopausal for many years, there's one extra disease that women suffer from that men usually don't suffer, and that's actually osteoporosis.
Osteoporosis.
Yeah, correct. So unfortunately, while we're quite protected with our estrogen during our reproductive years, once we hit menopause, our bone density actually drops a lot drastically than what men experience. So we start running into problems of osteoporosis or osteopenia is actually the stage before osteoporosis when your bones start becoming brittle. So that one you will also have to start thinking about once you hit your menopausal years to do a baseline screening at least to understand where your bone health is. And so please remember to start taking your calcium supplements.
Yeah.
Unfortunately, men don't go around having osteoporotic fractures, but women do. So it's overall quite tough to become a woman.
Yeah, doc. I mean, it seems like, and I mean, amazing stuff. That so many things that you have shared today. I'm sure it will be definitely will be highlighted for a lot of women out there who are watching this. Thank you. If you're seeing this, please do share and like. Dr. Ng Kailin from the ACRM. So if you do want to contact her, you can always Google her up. And is there any particular website or any contact details that they can look for, Doctor?
They can probably just Google my name. And
Okay.
yeah, nowadays everything is on the net. But in
Right.
terms of screening, I want to, make a point and say, screening options are everywhere. There are there's some threshold that some women feel that, oh, it's so troublesome, I need to go all the way to see a gynae just to get the screening done. Of course, the gynae will be able to do your screening very effectively, but if you find that it's very difficult to get a gynae or very far away, you have to remember that there are options available everywhere around you. So there are GPs who can do your screening, there's the polyclinic, and there's also gynae. So the first step is always the hardest. There's a Chinese saying that the journey of 1,000 miles actually begins with a single step. So as long as you're able to take the first step to get the screening done, I think that after you get that hurdle over, you'll find that things get a lot easier down the line. It's always the first time that you go for the screening, the first time that you do anything that is always the hardest. So that's
Doctor, I think we
really
miss. I
what we
think
hope.
I think we missed one part. I think we missed endometriosis as well. We talked about that on our last talk session. I think that
Correct.
one also is there a particular test also, right? Is they got to see whether they have this particular endometriosis as well?
So usually endometriosis will manifest in certain period problems like super painful periods and all that. So if you do start encountering that, then yes, you will need to check in with a gynae because we will have to do an ultrasound pelvis and see if there's anything going on. So many, many things that a woman needs to look out for, unfortunately.
Yes, I still clearly remember we mentioned this in the endometriosis. We talk about it. So yes, doctor, thank you so much again on the topic of the for the month of January on the cervical health awareness, to share the woman's issue and what they should do and what kind of test they should be there. What is the frequency? So thank you so much, Doctor Ng Kailin, for joining us again at Kopi with Vance. Thank you so much,
Thank
doctor.
you for having me.
Thank you. We'll catch up soon again. Thank you. So yes, that was Dr. Ng Kailin. So she's the a speaker for today for the topic of Cervical Health Awareness Month. Who she shared, I think, a lot of valued experiences that she actually shared, and I think a lot of women out there who are watching this, I think, is very crucial that you need to take note of all those stuff and precautions as well. So pains, presentations, if you have certain things that you should also take note. I hope you have enjoyed this session today. Yes, for the month of January, we are also going to cover glaucoma. All right, a glaucoma topic, which is the next week. We have an eye specialist who's coming on board. Just a little bit on glaucoma. I'm not going to touch a lot of that. Just a little bit. It's a high condition, right? And that damage the optic nerve as well, and the health, which is very vital for good vision, especially. These damage often caused by abnormal high pressure in your eyes. So sometimes it's good to see, to check your high pressure as well. In fact, glaucoma is one of the leading cause of blindness for people over the age of 60. Nowadays, it can probably in the early 50s, maybe mid 50s. We do not know, right? But I think all these answers will be given by a specialist who will be joining us next Wednesday at 9 p.m. on the topic of eye care. All right. So, yes, it's time for me to sign off. And again, I'll be joining you 9 p.m. Wednesday at Kopi with Vance. For now, adios, amigo. As usual, I say that. Catch you all around. Bye bye.